Good morning, and thank you all for being here today. I particularly want to thank County Supervisor Nathan Fletcher, who you're going to hear from in just a second. We have a good group of people here. I'm going to introduce some of them. This has been a team effort between the city and the county and our emergency response partners. We have our San Diego Fire Rescue Chief, Assistant Chief Chris Weber, who is here. Our San Diego Fire Rescue Deputy Chief of EMS, Chris Heiser, is here. Fire Rescue EMS Special Project Manager, Ann Jensen. Our City of San Diego EMS Medical Director, Chris Kahn. Dr. Mark Marvin, who's the Director of the Psychiatric Emergency Response Team, PERT. And members of our Resource Access Program, also known as RAP. We have Sean Percival, we have Amanda Keating, Michelle Vidana, Craig Tenma, and also from AMR, a fantastic partner, Mike Murphy. We have Mike Rice, and we have Matty Boudouin. Every day, San Diego's emergency 911 response system receives thousands of calls a day and night for help from residents and visitors alike. Unfortunately, there is a very small group of individuals who call over and over and over again. They call 911 all the time, and sometimes several times a day. And in a few cases, unfortunately, hundreds of times a year. They call because they don't know how to get help, and while they may not need emergency assistance every time, they do need help. Some of these frequent 911 utilizers are among the city's most vulnerable individuals. They suffer from chronic homelessness, mental illness, substance abuse disorders, complex medical conditions, or a combination of all of the above. That's what the Resource Assistance Program is all about. That's what RAP is all about, and that's why this program works. This is a phenomenal city-county partnership, and we have paired specially trained paramedics with mental health clinicians known as PERT clinicians to find these most vulnerable of our citizens, to intervene, to stop the medical, mental health, or social crisis at hand, and to be their advocate in helping to obtain long-term stability. Here's a fact, and I think it's an important one. RAP clients represent less than 1% of the total population, yet generate 20% of the emergency calls in San Diego. That's why these teams are so important to help bring this down. Unfortunately, many of these individuals call so often that they end up in a revolving door of costly emergency care that doesn't come close to addressing their underlying medical, social, and mental health needs. And I want to focus on mental health because we know that approximately 40% of the homeless population in our region also suffer from mental illness. And data from this program, the RAP program, shows that 90% of the current caseload involves individuals experiencing homelessness. This puts a strain on our emergency system and takes first responders away from responding to critical public safety emergencies across the city. The RAP program was initially started in 2008 as part of a pilot program and had additional teams from 2014 to 2016. And during that time, the RAP teams were able to help clients reduce their 911 calls and achieve a higher level of stability. In 2017, due to funding limitations, the program was reduced to one position. And then, not surprisingly, the number of callers jumped back up. But this May, the city, the county, and AMR came together to reinstate the program by committing paramedics, behavioral health staff, as well as 2 designated vehicles to better contact, connect, and transport clients. This program is exactly the right type of positive outreach that cities across the country should be doing. And it's using a data-driven approach. We are identifying those individuals who need specialized care, connecting them with the help that they need so they don't have to call 911. I will tell you, it's a shining example of how the city and the county can work together to find solutions to our mental health crisis. I am very proud of the work that our teams are doing to help folks get the services they need with one goal: how do we get them off the street, get the services, and lead a fuller, productive, and healthier life. Here today to talk about the county's commitment to the RAP program and creating that partnership, as well as his strong support for programs that help address our behavioral health crisis in this region, is County Supervisor Nathan Fletcher. And I would add that Supervisor Fletcher, since he has been elected, has really hit the ground running. And Supervisor, it's exact these type of partnerships where we're going to make a difference in people's lives. So please help me welcome County Supervisor Nathan Fletcher.
Thank you, Mayor. Thank you, Mayor. Thank you, Mayor Faulconer. Good morning. I want to just say a word that I appreciate the commitment of Mayor Faulconer to these issues, and I appreciate the work that we are doing together. You know, so often when you confront problems, it's like one entity or one group tells the other that there's a leak in your side of the boat. But the reality is we're all in this boat together, and we all have to work together to try and address the very significant issues that our region faces. And today is yet another step forward in that effort. Today we show the city and the county working together to drive real action to tackle the homeless challenge, provide more efficient and more effective mental health services to those most in need. And this really is a collaborative effort between AMR and our ambulance providers, between our fire rescue folks, between the city of San Diego and the county of San Diego. There's an African proverb that tells us if you want to go fast, go alone. If you want to go far, go together. And with all of these folks standing together and moving together, I believe we can go very far in addressing the challenges that our neighborhoods and our communities and our regions face, and helping those who so desperately need help and assistance and care. I want to thank Assistant Chief Chris Weber for hosting us here at Fire Rescue Station 1. AMR paramedic Sean Percival, thank you for joining us. We're going to hear about his experience being out on the streets. The director of the county's psychiatric emergency response PERT team, Dr. Marvin, is here. It is very difficult work that our EMT folks and our PERT team members do every single day. It's often thankless work, and we want them to know that they are appreciated, that they are supported, and that we are working to try and build out a system of care to meet the need that's there. I'm pleased to see the county back committed to this program and the city together, and we're pushing on a number of fronts. The budget that the county will consider tomorrow represents one of the single largest increases in behavioral health services in the history of San Diego County. We're looking at collaborative efforts we can do in partnership with the city at our Rosecrans place in Hillcrest and throughout the region, so that we can really work together to have a partnership that exemplifies a spirit of cooperation, a spirit of progress, but most importantly for the folks who are in neighborhoods who are impacted by this, a spirit of action, of real sustained progress, with each one of these individual things being a piece of a broader puzzle to make a real difference. 100% of my county supervisorial district overlaps with the city of San Diego, and when I took office, one of our aims was to partner with the city, to partner with Mayor Faulconer, to partner with the council, to really begin to address our regional needs together. And we have done that in a number of things, on homelessness, on community centers, on more reliable transit. We're trying to work together on clean energy, and today is very much a continuation of that spirit of us working together. Our region needs action tackling the challenges facing our most vulnerable residents. This can be an example not only for the rest of our region, but for the rest of California, where we have teams of trained medical professionals through this program who can move quickly to help people experiencing homelessness, behavioral health emergencies, and other trauma-induced situations, while simultaneously reducing the burden on our 911 system and getting these folks into the most appropriate level of care in a way that can sustain much better outcomes and potentially be a savings to the taxpayers. That is connecting them to the individual care that they need. This targeted approach will provide better outcomes, and by taking action, we're working smarter. we're being more efficient with the resources available, and we're targeting those services that make sense. So again, I'm incredibly grateful for Mayor Faulconer for his leadership and willingness to stick with this. I'm incredibly grateful for our county staff and workers who are here, and all of our first responders who really are trying to do the right thing. And so today is a good day. It's a day of action. It's a day of progress. It's a day of cooperation and coordination, and a day that we certainly all want to see replicated in many other fields as we try and make San Diego a better place. So thank you, Mayor Faulconer, and everyone. Thank you.
Thank you, Supervisor. Thank you, Nathan. Thank you. Thank you. Thank you, Supervisor. And again, your help and your support, the work that you're doing at the county, translating what we need to do to budget and to resources is extremely important. You have my full support, so thank you. Next, I'd like to invite our AMR paramedic, Sean Percival, to share his experience in working with a client who is now on the road to recovery due to his team's intervention. And at the end of the day, that's what this program is all about: intervening, making a difference, reducing the burden. Sean?
Hello, I am Sean Percival, an AMR community paramedic from the City of San Diego RAP team. I'm here today to share a patient success story. Earlier this year, we received a call from a medic unit about a lady, Julie, who was seeking help and was turning to 911 quite frequently. As it turned out, she was one of our top 10 users of 911, calling the emergency line about 60 to 70 times per year. When we see this kind of call volume, we see a cry for help. A patient in a dangerous situation that needs intervention. So my partner, Michelle Vidania, and I went to find Julie. We soon found her and her boyfriend intoxicated, laying in the sand of the beach, exactly where the medics told us she would be at. We woke them, introduced ourselves, and offered our help. Surprisingly, Julie jumped up, woke up her boyfriend, and said, "Get up, today's the day we change our lives." This is not normally how it goes for us. Typically, from our experience, it takes several visits to build the kind of rapport that it takes to motivate someone to change. The fact that Julie jumped up and wanted to go before knowing much about us left me speechless. But we collected their belongings and took Julie and her boyfriend to a temporary sobering center. Shortly after, a bed had opened up at a medical detox facility, and our other RAP team with community paramedic Amanda Keating and her PERT clinician, Kel Williams, helped Julie get medically cleared and into the detox program. After spending some time there, she was placed into long-term treatment. Our RAP team continues to support Julie with a variety of things. This includes getting a valid ID, her birth certificate, or anything else that she needs to become successful and more self-sufficient. Today, Julie is doing amazingly well. She's living in an apartment, working hard in therapy, and serving as a role model to others just like her. She tells us she's been back to her old areas, visiting her old friends to help them out of homelessness, and she's also volunteering at a church regularly she attends with her boyfriend. Professionally, Julie plans on moving into a peer support role and is looking at taking classes that'll help get her there. She's an inspiration to all of us, and there is no doubt that she will make a great advocate for others. I'm very happy RAP is back in action, expanding and helping people get their lives back. I want to thank AMR, the City of San Diego, for the opportunity to serve as a RAP medic. I would also like to thank the county for bringing the PERT team to the table. Thank you.
Very good. Thank you. Great example. Our last speaker this morning, so we have Dr. Mark Marvin, who is the director of the PERT teams, who's here to speak about the behavioral health aspect about this program and why it's so important that we're all working together. Dr. Marvin?
Thank you, sir. Appreciate it. Thanks for being here today. I'm Dr. Mark Marvin of PERT, Psychiatric Emergency Response Team. We are one of many programs of Community Research Foundation and a proud contractor to be affiliated with the San Diego County Behavioral Health Services. This is PERT's 23rd year of service, which is stunning to many to hear that. But it's always been about evolving to meet the needs of the community and this program is quite the milestone in our history. Just to give you some context, we are currently funded for 70 PERT clinicians who are paired with law enforcement. 65 ride with patrol officers and deputies, 5 are with homeless outreach teams. The majority of these calls are reactive, responding to 911 calls for service when people are at the very toughest times of their lives psychiatrically. This program, of which we are currently funded for 2 paramedic clinicians to be paired with, is quite astounding because this is actually proactive instead of reactive. What this means is we have an extremely trauma-informed program where we can go out and try to cultivate relationships with those who are most vulnerable. This is great not only for the consumers in crisis, but it is also a wonderful thing for their family members as well as their supports in life. And what happens is that we can slow down the process and really understand someone beyond just a bunch of symptoms, but to really identify what the driving issues are underneath and how we can best hook them up with services. This program also will allow for aftercare, a very proactive outreach service. So we are very excited about this program. And my hope is that this 2 PERT clinician pilot program will evolve into being countywide because I really see a lot of benefit here. It benefits, again, not only the consumers, their supports, but it also benefits law enforcement. It puts less of a strain on law enforcement resources, and it also opens up the emergency departments across the county to provide services. So as we hear from around the country, our success, PERT success, is really the success of collaboration with, again, BHS, our elected officials, and really listening to consumers because they're the ones that really matter. So thank you all for your support. One other thing I want to say in terms of training, looking forward, we are currently training all EMTs and paramedics of San Diego Fire to ensure that we can enhance their understanding of identifying persons in behavioral health crisis and those with substance use, and also so they can more identify how PERT can be of service. So thank you for your attention. Appreciate it.
Thank you all. This is a real team effort. It'd be great to get back out there, as I said, making a huge difference, and as the doctor just said, on a proactive basis. Thank you all for being here. Thank you, everybody, and for those members of the media, everybody who will be available for any questions one-on-one. Thank you very much. Thank you, my friend. Good job. Thank you, guys.